So in this module we'll go with regional orthopedics. Okay, so the first topic is CRPS. Okay, so what is CRPS? Is complex regional pain syndrome. Okay, which is also known as Sudeck atrophy. Okay, so why it happened? Because of nerve injury or involvement. Okay, so CRPS basically of two types. So CRPS 1 and CRPS 2. CRPS 1 is due to trauma. Okay, suppose there is a fracture and you do casting, okay, then it can may lead to CRPS syndrome. And in the CRPS type 2 variety, in which direct nerve gets damaged. Okay, right. So what's the symptom and sign? All right, so if you see, for symptom and sign, there is a criteria known as Budapest criteria. Okay, so as it is a nerve involvement, so all the features of nerve like motor, sensory and sympathetic will be involved. Okay, so according to that, in the case of sensory, there will be hyperalgesia. Okay, which means a simple touch can give to pain sensation. Okay, right. There's a vasomotor changes which means the skin color asymmetry and temperature asymmetry. It is due to sympathetic and parasympathetic involvement of nerves. Okay, then it's a pseudomotor involvement. Okay, which means there will be edema and the sweating changes. All right, and the last is the motor involvement, in which you can see weakness, tremor and trophic changes. Okay, the trophic changes involved shininess of skin and loss of hair. Okay, so if you can see this clinical picture, you will get better idea. Okay, just a second. Yeah, okay, so you can see this difference. So this is the normal leg and this is the having CRPS syndrome. Okay, in which you can see the edema, redness. Okay, so pseudomotor. All right, so it's swelling, edema, redness. Okay, and again with the examination you will get the motor and the sensory finding. All right, so see the difference. If there is a clinical picture like that, the diagnosis is CRPS. All right, it's a clinical diagnosis. All right, so after diagnosis, let's go to treatment. Okay, so the treatment will be basically of supportive therapy. All right, like large amount of vitamin C, vitamin D, your calcium and bisphosphonate supplement, or a nerve modulator like pregabalin, okay, to block the sympathetic system. All right, so the treatment will be of supportive therapy. And also in X-ray you will see osteopenia. Okay, especially in CRPS type 1 subtype. Okay, you will see the osteopenia in X-ray finding. Okay, so after that, let's start our second topic is rotator cuff tear. All right, so as you will see, right, so basically rotator cuff involves four muscles. Okay, if you see the anteriorly is the subscapularis muscle. Okay, So you'll see like this. So anteriorly there is a subscapularis muscle,